to late addiction often will begin to have suicidal thoughts as their life starts to become more and more unmanageable. So late stage of addiction, or using to feel normal. Person may start to use all day long, loss of control when it comes to starting or stopping. The use starts to become compulsive. Without serious interventions, the use patterns will lead to the following issues. Emotional deterioration. Feelings become overwhelming. Depression and anxiety are constant. There's a chronic anger, shame, guilt, or fear. One of my favorite quotes by Homer Simpson is, alcohol, the cause of and solution to all the person's problems, right? And so that's what ends up happening. It's causing the chronic anger, the shame, the guilt, and the fear, but it's also the solution to those things. Can't live with the drug, can't stop. The person may try to stop using on their own, though it is often with little success. The phrase tomorrow, tomorrow, tomorrow becomes the mantra. The person may have frequent blackouts, lose time, wake up in hospitals or jails, and not be sure how or why they got there. They may go days, weeks, or even months without being sober. The person in late addiction may have to wake up in the middle of the night just to use just so they can go back to sleep. Serious physical health problems start to happen during this period. Tolerance will start to actually decrease the longer they're in this stage. The person is close to death as the tolerance becomes less and less. And institutions become frequent flyers at institutions, jails, emergency rooms, psychiatric hospitals. I worked in the jail for over 2 years, and it was incredible the amount of familiar faces that I would see coming in over and over again. And the same was the case for the detoxification facility that I worked at. Frequent suicidal ideations, plans, or attempts, and a lot of times these frequent suicidal attempts end up getting miscategorized as overdoses. All right, so the person gets sober and everything's great, right? Unfortunately, that just isn't the case. I wish it was that easy. Post-acute withdrawal can be even sometimes worse than the actual person who's actively in their addiction. Just because a person is detoxed and is working on their recovery, it does not mean that they're no longer at risk for dying by suicide. Post-acute withdrawal is a period of time that occurs after a person is detoxified from all drugs that they have taken. How long that person withdraws really depends on the type of drugs that they used and how long they were using it, but usually it's anywhere between 3 to 7 days for the acute withdrawal period. However, as many of you know, there's a period after this that there's lingering side effects from use. Due to its length, anywhere from 6 months to a year, and sometimes even years for individuals, this period tends to be much more difficult to navigate than the acute withdrawal phase. Some of the symptoms of post-acute withdrawal can leave a person at risk to suicide. Anhedonia. Anhedonia is just a fancy word for inability to find pleasure in things that used to be pleasurable. So things that the person used to find fun or interesting